Hello, I'm Dr. Manchakanti, the Medical Director of the Pain Management Centers of Paducah and Marion, and Chairman of the Board of the American Society of Interventional Pain Physicians. Regenerative medicine broadly describes an innovative medical therapy that will enable the body to repair, replace, restore, and regenerate damaged or diseased cells, tissues, and organs. Regenerative medicine represents a new paradigm in human health because the vast majority of treatments for chronic and life-threatening diseases focus on treating the symptoms, not curing the disease. Regenerative medicine is mainly based on cellular therapies which amplify our natural healing process in the place it is needed most or take over function of a permanently damaged organ. Regenerative medicine is a new field specifically in managing chronic pain. Regenerative medicine with stem cell therapy is much advanced in other areas. The developments in chronic pain management include the use of platelet-rich plasma or PRP and adult stem cells to help build healthy discs, tendons, cartilage, ligaments, and bone. We provide regenerative medicine utilizing current principles under image guidance.